85-year-old client presented to the clinic diagnosed with rheumatoid and stage 4 hypertension. Her blood pressure was assessed upon the initial consult. It tested at 160 over 100 millimeters of mercury with evident joint inflammation in knees and hands. She's currently taking methotrexate 15 milligrams each Friday morning, folic acid each Saturday morning, Atacans 8 milligrams a day for hypertension, and fish oil 1,000 milligrams a day for bone health. Chief complaints are mild to moderate pain and stiffness during rheumatoid flare-ups, chronic insomnia that has progressively worsened over the last 8 to 12 months. Her diet is optimal for her age. More water is required as she only has about 500 ml a day. Coffee intake could be reduced to at least 1 espresso a day, and client still enjoys regular morning walks and is a very avid gardener. Medication she's on, methotrexate is a chemotherapeutic agent, an anti-rheumatic and an anti-folate agent. Works for rheumatoid as a dihydrofolate reductase enzyme inhibitor. Atacan works as an antihypertensive that alters the renin-angiotensin system by its ability to block angiotensin II and associated receptor docking sites. Predisposing and causative factors for rheumatoid insomnia: a family history of genetics, musculoskeletal damage from daily gardening, autoimmune dysfunction, and possibly an underlying gradual build-up of distress from being alone most days. Sustaining factors are regular gardening involving chronic strain on joints each day, cold environments such as winter and brisk mornings, distress and loneliness of being home alone most days as most family members are in other countries or have passed away. Obstacles and strategies to the treatment. She finds alcohol tastes terrible but is still willing to try liquid herbal formulas. Adding 7.5 ml twice daily to water or juice may help dilute the taste. Otherwise, substituting ethanol extracts for glystrax were available. Lastly, powdered or extemporaneously compounded herbs might be another option. Energetics of the client: her vitality and energy have been clearly affected from the ongoing flare-ups and that are worse for cold mornings, and externally she appears to be quite a rigid, stoic person in nature, yet expresses very frequent concern over the health of others. So warming remedies may be perfect to alleviate this sort of rigidness. Main treatment priorities are to improve onset, quality and duration of sleep, utilising mild sedatives, hypnotics and adaptogens in order to enhance and sustain vitality and quality of life and stabilise emotional responses. Prescribe herbal formulas to assist with reducing chronic inflammation, including a topical analgesic reduce pain when an acute and aggressive flare-up next occurs. Support optimal heart and joint health through dietary and lifestyle recommendations such as the Mediterranean diet, including suitable cardiotonics and or hypertensive herbs if required. Short-term treatment aims are to improve sleep onset and maintenance with mild sedatives and hypnotics, measuring outcome during the 2-week follow-up using the Insomnia Severity Index, reduce severity of pain during acute flare-ups with analgesics, measuring outcome using a pain rating scale, reduce acute local inflammation with anti-inflammatories, measuring outcome using the DAS28 PROM, and assess swelling severity and number of affected joints. Enhance patient vitality and modulate emotional response through adaptogens, measuring the outcome using the DAS questionnaire PROM. Long-term aims are to sustain adequate sleep onset and quality through long-term lifestyle modifications and herbs where required, and reduce frequency and severity of acute flare-ups to maintain long-term vitality. APM is the first herb being selected for review, rich in phthalate, essential oil, flavonoids, coumarins and furanocoumarins. Main actions are anti-inflammatory and anti-rheumatic. Key indications are for osteo and rheumatoid arthritis along with rheumatism. Pros of the herb are it may provide an additive effect of the current prescribed medications, and it does not appear to alter any P450 enzymes involved in the drug metabolism. Cons are studies on the anti-inflammatory actions are largely speculative, as in they've been conducted mainly in vitro or on animals. Valeriana officinalis is rich in valproates, essential oil, valerianic acid and its derivatives. Key actions are anxiolytic, sedative, hypnotic and spasmolytic. Main indications are for insomnia, sleep onset and maintenance, and hypertension. Pros are effective gentle sedative and hypnotic, extensively prescribed for anxiety, stress and insomnia, and no major interactions have been identified. It is also good to use prophylactically. Cons: caution is advised in concurrent use with prescription sedative drugs such as benzodiazepines. Withania somnifera. Main herbal constituents are withanolides and tropane-like alkaloids. It's a general and cardiotonic, adaptogen, sedative and anti-inflammatory, as well as an immunomodulator. Key indications are for debility, chronic immunodeficiency, tonic for the elderly, insomnia and osteoarthritis. The main pros are it is highly indicated as a tonic for the elderly with sleep troubles, and it's extremely gentle herb and a broad healing herb. Cons are potential interaction with methotrexate, as it's an immunodepressant and the herb is an immunomodulatory. So no data has been found to support this theoretical interaction though. Zingiber officinale, rich in pungent compounds such as gingerols and essential oil. The main actions are carminative, peripheral stimulant and anti-inflammatory. Key indications are for osteo and rheumatoid arthritis and rheumatism. Main pros are it is highly indicated for rheumatoid. Gentle warming nature of ginger works well for stimulating circulation, warming areas of the body such as joints and muscles. Main cons may cause gastric irritation in people with gastric ulcers, H. pylori infection, reflux or gastritis. Capsicum frutescens is rich in capsaicinoids, carotenoids, flavonoids and phenolic acids. Main actions are it is a topical analgesic, pungent, circulatory and metabolic stimulant. Key indications are for rheumatoid and osteoarthritis and impaired peripheral circulation. The main pros are external application can provide significant analgesia for joint pain, lumbar pain and other musculoskeletal pains. The cons are the gastric aggravating properties when it's taken internally as an extract do not apply to broken skin or wounds over the affected area. The herbal prescription I've selected is 30 ml of apium, 40 ml of withania, 15 ml of zingiber and 15 ml of valeriana. Liquid dosage instructions are 7.5 ml twice daily. First dose around lunchtime, at least 6 hours after current medications, and the second approximately 1 hour prior to bedtime. The prescribed topical preparation is 3 ml of cayenne extract infused into 50 grams of vitamin E cream to be applied topically to the affected joints. Rationale behind withania selection is it's a gentle, mildly sedating adaptogen, antioxidant and immunomodulator that is also an anti-inflammatory. Highly indicated as a tonic for the elderly, especially with insomnia, traditionally used to treat arthritis. The GABAergic properties of the compound of the herb provide profound relief and enhancement of energy and vitality. Main rationale behind valerian selection is its potent, gentle, hypnotic and sedative, safe to prescribe long-term. Studies comparing valerian against benzodiazepines found it was equally as effective at inducing and maintaining sleep without day-after sedation. Valproates exhibit GABA modulatory and GABA reuptake inhibitory activity and are believed to cross the blood-brain barrier via different transport mechanisms compared to benzos. Zingiber rationale is it is a potent anti-inflammatory with a high number of antioxidants. The inhibition of anti-inflammatory cytokines and reduction of antioxidants that attack joint tissues. High suitability to the case, and it stimulates peripheral circulation of blood while exhibiting a very warming energy. The rationale behind apium is it's used traditionally as a diuretic, clinically prescribed as an anti-inflammatory for the treatment of conditions such as osteoarthritis. Many constituents exhibit protective properties due to the antioxidants. Much of the cited literature is based around apium in cases of arthritis. Capsicum selection was due to the pronounced analgesia when it's applied topically, simultaneous stimulation and blockage of pain impulses being transmitted by substance P, which capsaicin depletes the fibers of this substance, and high efficacy of providing topical analgesia. To conclude the case, anticipated outcomes for mild sedatives and hypnotics are to see a rapid response to the sedative remedies within 2 weeks at least. Response will likely exert a marked improvement in vitality once client obtains adequate sleep. Expected outcomes for the anti-inflammatories and analgesics are improved inflammatory responses to the rheumatoid flare-ups, reduced pain and enhanced joint range of motion over the next 4 to 8 weeks. That is it. Thank you very much.